Hi there, I'm Dr. Angie, and this is my pug. I don't know if you can see him, Mr. Pugsley. And in this video, I'm going to be answering pet parents' questions about CBD. So let's get started. Mary writes, does CBD work on seizures that originate subcortically? So that just refers to the place in the brain that the seizures are happening. Do you know if CBD can interact with Keppra and increase the liver enzymes? So Mary, to answer your question, we don't really know enough about dog seizures and CBD to know what parts of the brain CBD might be effective for seizures. There's one study out of CSU that shows that CBD can be helpful for seizures, but as far as seizures originating in different parts of the brain, we haven't gotten that specific. Unfortunately, CBD aside, we don't have a lot of specific information in the location of the brain for seizures. Anyways, your second question is, do you know CBD can interact with Keppra? I've used CBD with Keppra a lot. I haven't seen any interactions. It's possible that CBD could increase blood levels of medications that are used to treat seizures, but so far in practice, I haven't recognized that. And then can CBD increase liver enzymes? There is one liver enzyme that at high doses CBD might increase. And so if you're using anticonvulsants and you're using CBD, I would recommend having your veterinarian check your dog or cat's liver enzymes regularly. I haven't seen any problems in practice, but in the studies that have come out, there is one liver enzyme that can be mildly elevated. We don't know if that's permanent or just at the beginning of CBD use, and we really need to find out more information about what's going on there. Megan writes, my cat was recently diagnosed with oral squamous cell carcinoma. She's currently on Clavamox and Buprenex. Are there any contraindications with these medications if I add CBD oil? So to answer your questions, not that I know of. I use Clavamox and buprenorphine or Buprenex with CBD all the time, and I haven't seen any interactions. Theoretically, since buprenorphine is a narcotic, it's possible that there could be an interaction, but I think you'd have to be at really high doses, and I haven't seen any of that clinically. There are no studies that are investigating the use of both of those, and really we don't have any studies investigating the use of CBD for cats anyways. I've seen it be extremely effective, and I think you should definitely give it a try, but I don't worry too much about interactions with those drugs. I always start small and then work up. My third question is, I started my 10-year-old boxer on HempRx Forte, which helped her dry patches of skin. But after 6 months, her liver enzymes were very high. The vet recommended to take a break from the CBD and put her on SAMe and milk thistle. However, her skin condition has gotten worse without the CBD. Can I give her CBD while also being on SAMe and milk thistle? Can coconut oil that is added to the CBD cause a flare-up of pancreatitis? To answer your question about CBD and liver enzymes, like I said earlier, it's possible that it is causing an increase of liver enzymes, although I haven't seen it cause multiple liver enzymes to be increased. What I would recommend doing is stopping the CBD for a couple months, rechecking the liver enzymes, and seeing if they go down. There are a lot of reasons why liver enzymes are elevated, and it could have nothing to do with the CBD. Doing an ultrasound and doing a workup to see if you can determine the cause of the liver enzyme increase would be another thing to consider. As far as CBD in coconut oil causing pancreatitis, it would really depend on how much of the coconut oil you're using and how concentrated the formula you're using is. So you would have to use a lot of it, but if you don't have a very concentrated formula and you're using a high volume, it could flare up a dog that's already prone to pancreatitis. If you have a question for me, you can email me at Angie, Angie@boulderholisticvet.com, and I will talk to you soon.